my name is Jørgen Gad. I'm a master dental ceramist based out of Oslo, Norway. I run Art Pro Dental Design and we are specialized in high aesthetics. Today, together with my dear friend, Dr. Lars Husby in Trondheim, we're going to show how we use the iTero scanner to better workflow, patient communication, and overall better restorative work. So first, let's go to Trondheim and see Dr. Lars Husby, 490 kilometers away from Oslo, where I'm located.
Hi, my name is Lars Husby. I'm a general dentist from Trondheim in the middle of Norway. I started using iTero for the first time in 2011 and I bought my first scanner in 2012. The iTero scanner has made my workflow very effective. I save a lot of time and I can communicate with the patient in a visual way that is very helpful and makes the patient understand easier. And it makes the clinic very modern and it's a high-end clinic because of the digital workflow. I use the iTero scanner for almost every patient. I use it to visualize how their status is. I use it for showing them tooth wear. I use it for crowns, veneers, bridges, implants, and aligners. When I see the scan on the screen, I can use it to communicate with the patient. We can look at his situation or hers. I can show them how we can treat it, and I can even show the end result. Compared to 10 years ago, when we didn't have access to the iTero, we now have a lot higher acceptance rate, maybe 10-20% among our patients. Simply because it's easier for them to understand what we're talking about, and the scanner gives us, me and my team, a very good visual language. The iTero saves us a lot of time. Looking at it from a logistics point of view, we don't have to clean, pack and send the impressions. We can simply push the send button and the files are available at the lab within minutes.
Exactly, that's a huge advantage for the laboratory as well. We can see the scans and give direct communication with the dentist while the patient is still in the clinic. So it's a very nice way of communicating. iTero files are OpenSTL, which makes it very nice for us in the laboratory, and we can import it into any exocad backbone software that we have in the laboratory. The scans are extremely important that they are as accurate as possible. We spend a lot of time adjusting our models with parameters and everything to reach the highest precision. So we can do minimal and non-invasive dentistry on fully digital. I think that's the benchmark for precision in our industry, and it would not be possible without a very accurate scan. Every time we have a iTero scan with Dr. Lars Husby, the fit and the precision is always extremely accurate.
After my years using the iTero, my experience is that restorative work needs a lot less adjustments, and my veneers don't need adjustments at all. There is no way back.